Welcome back to the first Boston mayoral debate. We continue now here on CBSN Boston, WBZ News Radio 1030, and C-SPAN. So candidates, in a new MassInc poll sponsored by WBUR, the Dorchester Reporter, and the Boston Foundation, 71% of black voters and 61% of Latino voters said reforming the Boston police was a major priority. But 65% of black voters and 63% of Latino voters also said getting tougher on crime was a major priority. We'll start with you here, Councillor Essaibi George. Give us a specific example of how you plan to meet both of those needs at the same time.
Well, I think it's actually one of the most important responsibilities that I have as mayor of this city. We need to ensure that our city is a safe city and a just city. That work is incredibly important. We need to make sure that we have a police department and a public safety agency that is responding to the needs of our city's residents, but that it is also transparent, that it is also accountable, that it is also diverse and reflective of the city it serves. That is central to my work, that has been central to my message, although some of that gets left out of many conversations. We've got so much work to do to fulfill what I call the promise of community policing, where our communities, our community-based organizations, our city's residents are in partnership with our police department, and that they are present, that they are engaged, and that they are doing the very important work of keeping our city safe. I believe in investing in public safety, not defunding our public safety agency and the work that we need to do as a city.
Councillor Wu, 1 minute.
As you mentioned, our residents are very concerned, and what Boston needs right now is solutions, not sound bites, not scare tactics. We need to make sure that we are doing the work in community, and I've been proud to lead the work on the council of ensuring that our crisis response focuses on the public health as a major way that we are leaning into safety. I am the caregiver for a mother who lives with mental illness. I have been in those situations with that loved one as the police were called in an episode of mental illness, and to feel the terror standing next to her of what might go wrong in an instant with an armed law enforcement officer there, begging to make sure that she went to the hospital instead of the police station. We need to ensure that our resources are being spent in the right way, delivering the services that our residents need. We need that public health-led response. We need accountability when it comes to budget as well as misconduct. We need transparency across our department. I will ensure that the choice of the new police commissioner is one that will deliver urgently on reforms that are needed to the structures, the culture of our department, and get going right away on that underlying barrier that holds much of this back, negotiating a new police union contract.
All right, I just want to clarify something before you move on with this.
Please do.
You mentioned, quote, defunding the police. That's a very charged term. Are you saying that's what you perceive your opponent as calling for?
Yes.
Go ahead.
So very first, I'd like to say that Michelle has not led on the reforms that are necessary, especially as it relates to a mental health response for our Boston Police Department in responding to the needs of our city's residents. When I joined the council in 2016, there were 2 best clinicians associated with this work. I worked with our former colleague to ensure that there are 4. 2 cycles ago, I worked to ensure that there are 19 clinicians doing the very important response of assisting our city's residents in need. This has impacted the experience at Mass and Cass. We still have a great deal of work to do in Mass and Cass, especially as it relates to women who are victims of violence. There's still a great deal of work we need to do in expanding the best clinicians across the Boston Police Department in partnership with BMC, but that is the work that I've led on as a member of the Boston City Council. I will also say we don't need to wait for a new commissioner to put in place the reforms that have been recommended by the Boston Police Task Force. That accountability task force has recommendations that are in place today, waiting for implementation. On day 1, with or without a commissioner, we can put those recommendations in place, and I am committed to doing that.
Equal time, Councillor Wu.
I'm grateful for Councillor Essaibi George's leadership and advocacy to make sure that we have grown the number of clinicians, and was proud to support those efforts. But going from 2 to 19 clinicians, when we have hundreds of thousands of residents across the city needing services, calling for crisis response that often includes situations that we are not delivering the right services, we need to be fearless in reaching for the scale of change that our residents deserve. There have been far too many headlines about how deeply we need reforms when it comes to policing in Boston. I will ensure that this city continues to lead the way in demanding justice and healing, and doing so in partnership with community. That means leaning in on the pilot that I'm proud to see Mayor Janey already moving forward for a co-response model, for a response that centers mental health clinicians in this crisis response. But the bottom line is that the task force's recommendations echo the audit of the police department conducted many years ago, which echo the demands of our residents over decades and generations. What has been holding us back is political will to see changes at the scale that we need. I am the only candidate who has put forward a specific plan on how to negotiate that collective bargaining contract that will embed accountability and transparency.
Well, let me ask you for a clarification. I'm sorry, didn't mean to interrupt you. Is there a serious difference between your position and that of your opponent?
There are differences. This is a big difference when it comes to the vision for how public safety and public health in the city will move forward. We have had many votes on the city council where the two of us have been on different sides of whether we are moving towards reforms that build trust and bring people into the conversation, ensure that we are not pitting safety against justice. And this is a situation where we need to lean into the scale of change, unafraid of what our residents deserve.
Go ahead.
So I'm not sure whether Michelle answered the question regarding defunding the police, but what I will say is the co-response model that is in place today, that has been championed by the acting mayor, is a product of my work on the Boston City Council. We have those co-responders in place today. We have the crisis intervention training in place today because of my work on the City Council. That has created an opportunity for me to understand that work very clearly and to be able to lead on that work as mayor. Again, we do not have to wait for these reforms. It is up to the mayor to get it done, and I will, starting day one as mayor of this great city.
A final word from you, and then I want to move on.
I've had many conversations with Mayor Janey and colleagues, and proud to have the mayor's endorsement and support in this race to continue building on what the city has been doing. This is an issue where other cities are ahead of us, where cities around the country have started to have a response to create a different response to crisis that centers public health, not only slowly growing, something that we have been working on here, but truly delivering the services that our residents need, which would not only help us meet people where they're at, but also reflect a more responsible budget and use of resources so we can free up our resources in the ways that our residents actually need.
All right, you both talk. Go ahead, briefly.
I do have one more thing to say, because we talked about votes on the council. It was last year's budget, which we had a critical vote that Councillor Wu voted against. And if that budget failed, we would have lost 43 EMTs and paramedics, which are so critical to our response here in the city of Boston. In the middle of a pandemic, when people are sick, people are not well, people are afraid and in crisis, those paramedics and EMTs are also a very important partner in that co-response model. If we want these activities, these actions, these decisions to succeed, we need to invest in them. It takes money, it takes dollars, and it takes decisive decisions to make it happen.
That was a very specific claim that begs a response.
That's simply not true. Again, we don't need scare tactics in the city of Boston. We don't need false choices that pit our residents against each other or underestimate what is possible for this city. We need to be leading the way in ensuring that we are getting to the root causes of violence in our communities and ensuring that we are building trust with community members when it comes to safety and healing and public health. I will make sure that everyone is part of this conversation, sees themselves reflected, and that we are moving in the direction with urgency on what we need to change.
I'll give you 15 seconds if you want.
Very quickly, that urgency for me is day one of my administration. We have to put those recommendations into place if we truly want greater accountability, greater transparency, and greater diversity within the Boston Police Department. And we have to commit to the men and women who are doing the very important work, especially as it relates to EMS, especially as it relates to mental health clinicians in this city, and doing such amazing work.
And the same for you, if you want it.
We have seen differences in votes between the two of us on this stage. We have seen differences in approach when it comes to how we should fund and move forward. I am fighting for a vision of public safety and health in Boston that goes to the root causes of what our communities need in partnership with each one of our residents.
Well, you